1. What is the primary method of assessing acute pain in a patient? A. Visual analog scale. B. Numerical rating scale. C. Patient self-report. D. Observation of vital signs. Answer. C. Patient self-report. Rationale. The most reliable method of assessing acute pain is through the patient self-report, as pain is subjective and can only be accurately assessed from the patient's perspective. While tools like the visual analog scale, A, and numerical rating scale, B, are useful, they are part of the self-report process. Observing vital signs, D, is not a reliable indicator of pain intensity. 2. Which of the following is a characteristic feature of acute pain? A. Long duration. B. Sudden onset. C. Persistent over time. D. Pain in the joints. Answer. B. Sudden onset. Rationale. Acute pain typically has a sudden onset and is usually associated with injury, surgery, or inflammation. It is short-lived and decreases as the underlying cause resolves. A chronic pain, on the other hand, lasts longer and persists over time. Acute pain may be localized, but not necessarily in the joints. 3. Which of the following medications is commonly used to manage moderate acute pain? A. Ibuprofen. B. Acetaminophen.
C. Morphine.
D. Aspirin. Answer. A. Ibuprofen. Rationale. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, commonly used to manage moderate acute pain by reducing inflammation. Acetaminophen, B, is effective for mild pain but lacks anti-inflammatory properties. Morphine, C, is reserved for severe pain. Aspirin, D, is also an NSAID, but it is often avoided in acute pain management due to its potential for gastrointestinal bleeding. 4. Which of the following is a non-pharmacological intervention to help manage acute pain? A. Ice therapy. B. Morphine.
C. Codeine.
D. Acetaminophen. Answer. A. Ice therapy. Rationale. Ice therapy is a non-pharmacological intervention that helps reduce inflammation and numb the affected area, providing relief from acute pain. Morphine B and codeine C are opioid medications and are pharmacological interventions, while acetaminophen D is an analgesic medication, not a non-pharmacological intervention. 5. What is a potential consequence of poorly managed acute pain? A. Acute anxiety. B. Chronic pain development. C. Decreased respiratory rate. D. Increased appetite. Answer. B. Chronic pain development. Rationale. Poorly managed acute pain can lead to the development of chronic pain, as the body's pain pathways may become sensitized. Acute anxiety, A, is a possibility, but it is not a direct consequence of poorly managed pain. Decreased respiratory rate, C, may be due to opioid use, and increased appetite, D, is not a direct consequence of acute pain management. 6. Which assessment tool is most appropriate for assessing pain in a nonverbal patient? A. Visual analog scale. B. Faces pain scale. C. Wong-Baker Faces pain rating scale. D. Numerical rating scale. Answer. C. Wong-Baker Faces pain rating scale. Rationale. The Wong-Baker Faces pain rating scale is commonly used to assess pain in children and nonverbal adults, allowing them to communicate their pain levels using facial expressions. The visual analog scale, A, and numerical rating scale, D, require verbal communication. The Faces Pain Scale, B, is another valid tool, but the Wong-Baker scale is more widely used. 7. Which of the following is an appropriate nursing intervention for a patient with acute pain related to post-surgical incisions? A. Restricting fluid intake. B. Administering prescribed analgesics. C. Encouraging strenuous physical activity. D. Elevating the head of the bed to 90 degrees. Answer. B. Administering prescribed analgesics. Rationale. Administering prescribed analgesics is a primary intervention for managing acute pain post-surgery. Restricting fluid intake, A, and encouraging strenuous activity, C, would increase discomfort. Elevating the head of the bed, D, may cause unnecessary strain on surgical sites. 8. What is the primary goal of acute pain management? A. To cure the underlying cause of a pain. B. To reduce the intensity of pain and improve functional ability. C. To prevent the transition to chronic pain. D. To minimize the use of narcotic medications. Answer. B. To reduce the intensity of pain and improve functional ability. Rationale. The primary goal of acute pain management is to reduce the pain to a manageable level, allowing the patient to function effectively. While preventing chronic pain, C, is important, functional improvement is the immediate goal. Curing the cause of pain, A, is often not possible in the acute phase, and minimizing narcotic use, D, is a consideration, not a primary goal. 9. Which of the following is a common side effect of opioid analgesics used in acute pain management? A. Diarrhea. B. Bradycardia. C. Constipation. D. Hypertension. Answer. C. Constipation. Rationale. Opioids commonly cause constipation due to their effect on the gastrointestinal system. Diarrhea, A. Bradycardia, B. and hypertension, D. are not typical side effects of opioids. Nurses should monitor for and manage constipation in patients on opioid therapy. 10. What is the best non-pharmacological intervention to reduce acute pain related to muscle strain? A. Applying heat therapy. B. Giving a warm bath. C. Applying ice therapy. D. Providing massage therapy. Answer. C. Applying ice therapy. Rationale. Ice therapy is effective for reducing inflammation and pain associated with muscle strain by numbing the area and decreasing swelling. Heat therapy, A, may be beneficial for chronic pain but can worsen acute inflammation. A warm bath, B, and massage therapy, D, may help with relaxation but are less effective in managing acute muscle strain pain. 11. A patient recovering from abdominal surgery reports acute pain at a level of 9/10. What is the most appropriate nursing action? A. Administering a prescribed opioid analgesic. B. Encouraging deep breathing and relaxation. C. Applying a heating pad to the incision site. D. Offering distraction techniques, such as watching TV. Answer. A. Administering a prescribed opioid analgesic. Rationale. In this situation, administering a prescribed opioid analgesic is the most appropriate action to manage severe acute pain. Deep breathing, B, and relaxation may help but are not sufficient for managing severe pain. Applying a heating pad, C, may worsen pain related to inflammation. Distraction techniques, D, can be helpful but are not the primary intervention for severe pain. 12. What is the most effective way to assess pain in a patient with cognitive impairment? A. Observing facial expressions and body language. B. Using the numeric pain scale. C. Asking family members about the patient's pain level. D. Relying on vital signs as a pain indicator. Answer. A. Observing facial expressions and body language. Rationale. In patients with cognitive impairment, observing nonverbal cues like facial expressions and body language is the most effective way to assess pain. Numeric pain scales, B, and relying on family members, C, may not be reliable in these patients. Vital signs, D, may not accurately reflect pain intensity. 13. Which of the following is the first priority when providing care to a patient experiencing acute pain after trauma? A. Assessing vital signs. B. Administering pain medication. C. Ensuring safety and comfort. D. Checking for signs of infection. Answer. C. Ensuring safety and comfort. Rationale. The first priority is ensuring the patient's comfort and safety while providing pain relief. Administering pain medication, B, should follow after safety and comfort have been addressed. Assessing vital signs, A, and checking for infection, D, are important but come after the immediate pain management needs are addressed. 14. A patient with acute pain after a hip fracture is receiving morphine through a PCA pump. What is the most important nursing consideration? A. Monitoring for signs of opioid overdose. B. Encouraging the patient to use the PCA pump frequently. C. Increasing the dose of morphine if pain is still present. D. Restricting the patient's fluid intake to prevent swelling. Answer. A. Monitoring for signs of opioid overdose. Rationale. When using a PCA pump, it is critical to monitor the patient for signs of opioid overdose, such as respiratory depression. Encouraging frequent use, B, could lead to overdose. Increasing the morphine dose, C, should only be done based on physician orders. Fluid intake. D. Restriction is not necessary for managing acute pain. 15. Which of the following is a common complication of untreated acute pain? A. Hyperactivity. B. Sleep disturbances. C. Weight loss. D. Hyperglycemia. Answer. B. Sleep disturbances. Rationale. Untreated acute pain can lead to sleep disturbances, as the pain prevents restful sleep. Hyperactivity, A, weight loss, C, and hyperglycemia, D, are not typical complications of acute pain. 16. Which of the following nursing interventions is most effective in preventing postoperative pain? A. Preoperative analgesia administration. B. Instructing the patient to take medication only when pain becomes severe. C. Encouraging ambulation as soon as possible. D. Applying ice therapy after surgery. Answer. A. Preoperative analgesia administration. Rationale. Administering analgesics preoperatively can help prevent the onset of postoperative pain. Waiting until pain becomes severe, B, is not effective for preventing pain. Encouraging ambulation, C, and applying ice, D, are beneficial for recovery but are not preventative measures. 17. Which of the following pain management strategies is most appropriate for a patient with a history of opioid addiction who is experiencing acute pain? A. Administering opioids as prescribed. B. Using non-opioid analgesics and adjuvants. C. Offering placebo medications to avoid opioid use. D. Avoiding any pain medications to prevent addiction relapse. Answer. B. Using non-opioid analgesics and adjuvants. Rationale. For patients with a history of opioid addiction, using non-opioid analgesics and adjuvants is a safer alternative to prevent relapse. Administering opioids, A, may pose a risk of addiction relapse, while placebo medications, C, are unethical. Avoiding pain medications, D, is not appropriate as it can lead to unnecessary suffering. 18. How does acute pain affect the body's autonomic nervous system? A, it causes sympathetic nervous system activation. B, it leads to parasympathetic nervous system activation. C, it causes a decrease in heart rate. D, it inhibits the body's stress response. Answer. A, it causes sympathetic nervous system activation. Rationale. Acute pain activates the sympathetic nervous system, resulting in increased heart rate, blood pressure, and respiratory rate. It does not activate the parasympathetic system, B, nor does it lead to a decrease in heart rate, C. The body's stress response is increased during acute pain, D. 19. A patient with acute pain reports nausea and dizziness after receiving an opioid for pain management. What should the nurse do first? A. Administer an antiemetic. B. Assess the patient's vital signs. C. Increase the opioid dose. D. Reassure the patient that these are common side effects. Answer. B. Assess the patient's vital signs. Rationale. The nurse should first assess vital signs to determine if the patient is experiencing signs of opioid overdose, such as respiratory depression. Administering an antiemetic, A, or increasing the opioid dose, C, should not be done without further assessment. Reassuring the patient, D, may delay appropriate care if the symptoms are serious. 20. What is the primary benefit of using patient-controlled analgesia, PCA, for managing acute pain? A. It provides a constant, non-stop level of pain relief. B. It allows the patient to control their pain relief and improve satisfaction. C. It reduces the need for nursing interventions. D. It eliminates the need for other pain management interventions. Answer. B. It allows the patient to control their pain relief and improve satisfaction. Rationale. PCA allows patients to manage their own pain within prescribed limits, improving their satisfaction with pain control. It does not provide constant relief, A, and nursing interventions, C, are still needed to monitor the patient. PCA does not eliminate the need for other interventions, D. 21. What is the most important factor when selecting an analgesic for a patient with acute pain? A, the patient's previous experiences with pain relief. B, the cost of the medication. C, the potential side effects of the medication. D, the effectiveness of the medication for the type of pain. Answer. D, the effectiveness of the medication for the type of pain. Rationale. The most important factor in selecting an analgesic is its effectiveness for the type of pain the patient is experiencing. While the patient's experience, A, and potential side effects, C, are important, medication choice should be based on how well it addresses the pain. Cost, B, should not be the primary deciding factor. 22. Which non-pharmacological intervention can help a patient with acute pain related to surgery? A, deep tissue massage. B, guided imagery. C, high-intensity exercise. D, ice therapy to the surgical site. Answer: B, guided imagery. Rationale. Guided imagery is a relaxation technique that can help distract the patient and reduce pain perception. Deep tissue massage, A, may not be appropriate immediately after surgery. High-intensity exercise, C, is contraindicated in the acute postoperative phase. Ice therapy, D, can be helpful, but is not a comprehensive intervention like guided imagery. 23. A patient with acute pain after a car accident is given opioids as prescribed. Which of the following should be monitored closely as a side effect of opioids? A, increased appetite. B, decreased level of consciousness. C, diarrhea. D, increased urine output. Answer: B, decreased level of consciousness. Rationale. Opioids can depress the central nervous system, leading to decreased level of consciousness. Increased appetite, A, diarrhea, C, and increased urine output, D, are not common side effects of opioids. Close monitoring for respiratory depression and sedation is critical. 24. A nurse is caring for a patient with acute pain after abdominal surgery. Which of the following interventions is most appropriate to promote pain relief? A, encouraging ambulation immediately after surgery. B, administering prescribed pain medications before the pain becomes severe. C, restricting oral intake to minimize discomfort. D, applying a heating pad to the surgical site. Answer: B, administering prescribed pain medications before the pain becomes severe. Rationale. Administering pain medications proactively helps prevent pain from becoming severe. Encouraging immediate ambulation, A, may not be appropriate post-surgery. Restricting oral intake, C, is unrelated to pain management, and heating pads, D, may not be appropriate for surgical pain, particularly if there is swelling. 25. A patient with a history of chronic pain is experiencing acute pain after a surgical procedure. What is the priority nursing intervention? A, administering additional pain medication. B, assessing for signs of opioid overdose. C, reassuring the patient that the pain will subside. D, providing comfort measures such as repositioning. Answer: B, assessing for signs of opioid overdose. Rationale. The priority is to assess for signs of opioid overdose, especially in a patient with a history of chronic pain. Administering additional medication, A, should be done only after assessing the patient. Reassurance, C, and repositioning, D, are helpful but secondary to safety concerns related to opioid use. 26. A patient reports feeling anxious and restless due to acute pain. Which intervention would best address both pain and anxiety? A, administering an opioid analgesic. B, encouraging the patient to engage in deep breathing exercises. C, applying a cold compress to the painful area. D, offering a sedative medication. Answer: B, encouraging the patient to engage in deep breathing exercises. Rationale. Deep breathing exercises help reduce both pain and anxiety by promoting relaxation. Opioids, A, may help with pain but do not address anxiety. Cold compresses, C, may reduce inflammation but not anxiety. Offering a sedative, D, could cause excessive sedation and does not address the root cause of anxiety. 27. Which of the following statements best describes the difference between acute pain and chronic pain? A, acute pain is always caused by tissue damage, while chronic pain is not. B, acute pain is temporary, while chronic pain lasts for months or longer. C, acute pain is usually caused by emotional factors, while chronic pain is due to physical causes. D, chronic pain is always more severe than acute pain. Answer: B, acute pain is temporary, while chronic pain lasts for months or longer. Rationale. Acute pain is usually short-term and results from an identifiable cause, whereas chronic pain persists for months or even longer. Acute pain can be caused by tissue damage, A, but it is not always. Chronic pain is not necessarily more severe than acute pain, D, and emotional factors can influence both types of pain. 28. A patient has been receiving opioid pain medications for acute pain, but is now experiencing constipation. What is the most appropriate nursing action? A. Discontinue the opioid medication immediately. B. Encourage increased fluid and fiber intake. C. Increase the opioid dose to relieve constipation. D. Administer a sedative to relax the patient's bowel muscles. Answer. B. Encourage increased fluid and fiber intake. Rationale. Opioid-induced constipation can be managed by encouraging increased fluid and fiber intake. Discontinuing the medication, A, could compromise pain control. Increasing the opioid dose, C, would worsen constipation. Sedatives, D, would not address constipation and could worsen the patient's condition. 29. Which of the following would be most helpful in assessing the pain level of a patient who is unable to communicate verbally? A. Asking family members about the patient's pain level. B. Observing the patient's facial expressions and body language. C. Relying on the patient's vital signs. D. Using the numeric pain rating scale. Answer. B. Observing the patient's facial expressions and body language. Rationale. In nonverbal patients, observing nonverbal cues such as facial expressions and body language is an effective way to assess pain. Family members, A, can provide input but may not be fully reliable. Vital signs, C, do not always correlate with pain intensity. The numeric pain rating scale, D, requires verbal communication. 30. A nurse is administering opioid pain medications to a patient. What is the most important aspect of pain management to monitor during opioid use? A. Skin color and temperature. B. Respiratory rate and level of consciousness. C. Urinary output and bowel movements. D. Blood pressure and heart rate. Answer. B. Respiratory rate and level of consciousness. Rationale. Opioids depress the central nervous system, so monitoring respiratory rate and level of consciousness is crucial to prevent overdose. Skin color and temperature, A, urinary output, C, and blood pressure, D, are important but secondary to respiratory and CNS monitoring in opioid use. 31. What is the primary goal of non-pharmacological interventions for acute pain management? A. To completely eliminate pain without the use of medications. B. To reduce the intensity of pain and improve the patient's overall well-being. C. To minimize side effects associated with opioid medications. D. To replace the need for pharmacological pain management. Answer. B. To reduce the intensity of pain and improve the patient's overall well-being. Rationale. Non-pharmacological interventions aim to reduce pain intensity and improve well-being by complementing pharmacological treatments. They are not meant to completely eliminate pain, A, or replace medications, D. While they may minimize opioid side effects, C, that is a secondary benefit. 32. Which of the following is the most effective method for preventing acute pain from becoming chronic? A. Aggressive early pain management with appropriate medications. B. Encouraging the patient to avoid using pain medications for as long as possible. C. Administering non-pharmacological treatments only. D. Ignoring mild pain until it becomes more severe. Answer. A. Aggressive early pain management with appropriate medications. Rationale. Early and aggressive pain management, including medications and interventions, helps prevent acute pain from becoming chronic. Avoiding pain medications, B, or only using non-pharmacological treatments, C, may allow pain to escalate. Ignoring mild pain, D, may result in inadequate treatment and worsening of pain. 33. What is the most common reason for underreporting pain in patients with acute pain? A. Fear of addiction to pain medications. B. Belief that pain is a normal part of recovery. C. Lack of understanding about the importance of pain relief. D. Cultural differences in pain expression. Answer. A. Fear of addiction to pain medications. Rationale. Fear of addiction is one of the most common reasons for underreporting pain, especially when opioids are prescribed. Beliefs about pain being part of recovery, B, and cultural differences, D, may also play a role, but fear of addiction is often the most significant factor. Lack of understanding, C, may also contribute but is less common. 34. A nurse is providing education to a patient who will be using opioids for acute pain management. What should the nurse include in the teaching? A. Opioids can be used for any type of pain. B. It's important to take opioids exactly as prescribed to avoid overdose. C. You should stop using opioids once you start feeling better. D. Opioids will not cause any side effects if taken correctly. Answer. B. It's important to take opioids exactly as prescribed to avoid overdose. Rationale. Patients should be educated on the importance of taking opioids exactly as prescribed to prevent overdose and misuse. Opioids are not suitable for all types of pain. A. They should not be discontinued abruptly when feeling better. C. And side effects are common, even with correct usage. D. 35. Which of the following is a common side effect of opioid analgesics? A. Hyperactivity. B. Respiratory depression. C. Increased blood pressure. D. Diarrhea. Answer. B. Respiratory depression. Rationale. Respiratory depression is a serious side effect of opioid analgesics and must be monitored closely. Hyperactivity, A. Increased blood pressure, C. And diarrhea, D. Are not typical side effects of opioids. In fact, opioids often cause constipation. Answer. B. Respiratory depression. Rationale. Respiratory depression is a serious side effect of opioid analgesics and must be monitored closely. Hyperactivity, A. Increased blood pressure, C. And diarrhea, D. Are not typical side effects of opioids. In fact, opioids often cause constipation. 36. A nurse is caring for a postoperative patient who is receiving opioid analgesics for pain management. What is the most important nursing intervention to prevent opioid-induced constipation? A. Administering a stool softener as prescribed. B. Encouraging the patient to ambulate frequently. C. Limiting fluid intake to prevent bloating. D. Providing a high-fat diet to reduce bowel motility. Answer. A. Administering a stool softener as prescribed. Rationale. Opioids commonly cause constipation, so administering a stool softener, A, helps prevent this. Encouraging ambulation, B, is important for overall recovery, but may not fully prevent constipation. Limiting fluid intake, C, and providing a high-fat diet, D, are not appropriate strategies for managing opioid-induced constipation. 37. A patient reports acute pain after a minor surgical procedure. Which of the following interventions should be implemented first? A. Administering prescribed pain medication. B. Encouraging the patient to use relaxation techniques. C. Reassuring the patient that the pain will subside. D. Applying a cold compress to the surgical site. Answer. A. Administering prescribed pain medication. Rationale. The first priority is to address the pain through medication as prescribed. While relaxation techniques, B, reassurance, C, and cold compresses, D, are helpful, they are secondary to providing the necessary pain relief first. 38. A nurse is caring for a patient with severe acute pain from a burn injury. Which of the following interventions should the nurse prioritize to manage pain effectively? A. Administering 4 opioids for rapid pain relief. B. Applying ice to the burn area. C. Encouraging the patient to take deep breaths and relax. D. Elevating the affected area above the heart. Answer. A. Administering 4 opioids for rapid pain relief. Rationale. For severe acute pain, especially in burn injuries, administering 4 opioids for rapid pain relief is the priority. Ice, B, can cause tissue damage, and deep breathing, C, may not provide sufficient pain relief. Elevating the area, D, is important for swelling, but does not directly address pain management. 39. A nurse is caring for a patient with acute pain from a fractured leg. What is the most appropriate method for assessing pain intensity in this patient? A. Using the Wong-Baker-Faces pain rating scale. B. Asking the patient to rate the pain on a numeric pain scale. C. Monitoring vital signs for changes. D. Observing for nonverbal cues such as grimacing. Answer. B. Asking the patient to rate the pain on a numeric pain scale. Rationale. The numeric pain rating scale is the most effective and reliable way to assess pain intensity in patients who can communicate. The Wong-Baker-Faces pain rating scale, A, is better for children or those with limited verbal communication. Vital signs, C, and nonverbal cues, D, are important but do not directly assess pain intensity. 40. A nurse is caring for a patient who is at risk for opioid overdose. What is the priority nursing intervention? A. Monitor the patient's pain level frequently. B. Administer naloxone Narcan if respiratory depression occurs. C. Encourage the patient to report any discomfort immediately. D. Provide educational materials about opioid side effects. Answer. B. Administer naloxone Narcan if respiratory depression occurs. Rationale. The priority intervention for a patient at risk for opioid overdose is to administer naloxone Narcan if respiratory depression is observed. Monitoring pain, A, and encouraging the patient to report discomfort, C, are important but secondary to preventing overdose. Educational materials, D, are helpful but not an immediate intervention. 41. Which of the following factors most likely increases a patient's risk for developing chronic pain after experiencing acute pain? A. Delayed initiation of pain management. B. The patient's age. C. The use of nonsteroidal anti-inflammatory drugs, NSAIDs. D. The patient's level of education. Answer. A. Delayed initiation of pain management. Rationale. Delayed initiation of pain management can lead to the development of chronic pain. The patient's age, B, use of NSAIDs, C, and education level, D, are not primary risk factors for the transition from acute to chronic pain. 42. A nurse is caring for a patient who is experiencing severe acute pain after an injury. Which of the following actions should the nurse take first to manage the patient's pain effectively? A. Offer the patient a pain relief pamphlet. B. Assess the patient's pain using an appropriate pain scale. C. Provide reassurance that the pain will subside soon. D. Encourage the patient to use deep breathing exercises. Answer. B. Assess the patient's pain using an appropriate pain scale. Rationale. The first step in managing pain is to assess its intensity using an appropriate pain scale. Offering educational materials, A. Providing reassurance, C. And using deep breathing exercises, D, can be implemented after assessing pain severity. 43. A patient is receiving opioids for acute pain. What should the nurse include in the teaching plan to prevent complications related to opioid use? A. You should increase your fluid intake to avoid dehydration. B. Take your opioid medication only when the pain becomes severe. C. Increase your activity level to reduce the risk of constipation. D. Monitor your respiratory rate closely and report any changes. Answer. D. Monitor your respiratory rate closely and report any changes. Rationale. Opioids can cause respiratory depression, so monitoring the respiratory rate is essential. Increasing fluid intake, A, helps with constipation, but is not the most critical instruction. Waiting for severe pain, B, is not advisable, and increasing activity, C, is not sufficient to prevent complications like constipation. 44. A nurse is assessing a patient who has received opioids for postoperative pain. The patient has a respiratory rate of 10 breaths per minute. What is the nurse's priority action? A. Administering naloxone Narcan. B. Increasing the oxygen flow rate. C. Stopping the opioid medication. D. Monitoring the patient's pain level. Answer. A. Administering naloxone Narcan. Rationale. A respiratory rate of 10 breaths per minute is indicative of opioid-induced respiratory depression. Naloxone Narcan should be administered immediately. Increasing oxygen flow, B, or stopping the opioid, C, is important but secondary to reversing the respiratory depression. Monitoring pain, D, is important but not the immediate priority. 45. A patient who underwent surgery is reporting pain. The nurse administers the prescribed pain medication, but the patient still complains of discomfort. What is the next best step in pain management? A. Increase the dosage of the pain medication. B. Apply heat to the surgical site. C. Reassess the patient's pain and consider adjunctive pain management. D. Reassure the patient that the pain will subside soon. Answer. C. Reassess the patient's pain and consider adjunctive pain management. Rationale. If the pain persists despite medication, the nurse should reassess the pain and consider additional or adjunctive pain management techniques, such as non-pharmacological interventions. Increasing medication, A. May not be necessary and can lead to side effects. Heat, B. May not be appropriate for certain types of pain, and reassurance, D. Is not sufficient. 46. A nurse is providing pain management for a patient with acute pain related to a fracture. Which of the following is the best non-pharmacological method to use alongside medication? A is distraction techniques such as listening to music. B. Aromatherapy with essential oils. C. Administering a sedative for relaxation. D. Applying a warm compress to the injured area. Answer. A. Distraction techniques such as listening to music. Rationale. Distraction techniques, like listening to music, can be effective in reducing pain perception when used alongside pharmacological treatments. Aromatherapy, B, may be useful but lacks the evidence supporting its effectiveness for acute pain. Sedatives, C, could interfere with pain management. A warm compress, D, may not be appropriate for acute fractures and could worsen inflammation. 47. A patient recovering from surgery asks the nurse how to manage the pain without using opioids. What is the nurse's best response? A. It is important to use opioids to control your pain effectively. B. We can try alternative methods, such as acetaminophen and non-pharmacological techniques. C. You should avoid pain medications and try to cope with the pain. D. Opioids are the only effective option for controlling postoperative pain. Answer. B. We can try alternative methods, such as acetaminophen and non-pharmacological techniques. Rationale. Non-pharmacological techniques and acetaminophen can be used to manage pain without opioids. Opioids, A and D, are effective for some patients, but are not the only option, and avoiding pain medications, C, is not advisable for adequate pain relief. 48. A nurse is caring for a patient receiving opioid therapy for acute pain. What is the priority nursing assessment? A. Monitoring for signs of infection. B. Assessing the patient's pain level regularly. C. Evaluating the effectiveness of the prescribed medication. D. Monitoring for respiratory depression. Answer. D. Monitoring for respiratory depression. Rationale. Respiratory depression is a life-threatening side effect of opioids, making it the priority nursing assessment. Pain level, B. Medication effectiveness, C. And infection, A, are important but secondary to ensuring respiratory safety. 49. A nurse is preparing to administer pain medication to a patient who has a history of opioid use disorder. What should the nurse prioritize when administering pain medications to this patient? A. Use the highest dose of opioids available. B. Use non-opioid medications whenever possible. C. Administer the same opioid dosage as for other patients. D. Avoid giving any pain medication. Answer. B. Use non-opioid medications whenever possible. Rationale. For patients with a history of opioid use disorder, the priority is to use non-opioid medications to minimize the risk of misuse or addiction. The highest dose of opioids, A, should not be used, and opioid dosages should be carefully considered, C. Withholding pain medication, D, is inappropriate. 50. A nurse is caring for a patient who reports severe pain after surgery. What is the most effective method for evaluating the patient's pain intensity? A. Observing the patient's facial expressions. B. Using a standardized pain assessment scale. C. Asking the patient to describe their pain in their own words. D. Monitoring vital signs such as blood pressure and heart rate. Answer. B. Using a standardized pain assessment scale. Rationale. Using a standardized pain assessment scale, e.g., numeric pain scale or Wong-Baker faces, provides the most reliable and consistent measure of pain intensity. Observing facial expressions, A, patient descriptions, C, and vital signs, D, can give clues but are less objective and reliable. 51. A patient is receiving opioid analgesics for postoperative pain. Which of the following interventions is essential to reduce the risk of opioid-induced nausea and vomiting? A. Administering antiemetic medications as prescribed. B. Encouraging the patient to take deep breaths. C. Giving the patient fluids to reduce dehydration. D. Keeping the patient in a supine position. Answer: A. Administering antiemetic medications as prescribed. Rationale: opioids commonly cause nausea and vomiting, so administering antiemetics, A, is the most effective strategy. Deep breathing, B, hydration, C, and positioning, D, may help with comfort, but do not directly address opioid-induced nausea. 52. A nurse is assessing a patient who is experiencing acute pain. The patient is unable to describe the pain due to language barriers. What is the best method for assessing pain in this patient? A. Use a pain scale with pictures to assess pain. B. Rely on the patient's vital signs to assess pain level. C. Ask family members to describe the patient's pain. D. Observe the patient's body language and facial expressions. Answer: A. Use a pain scale with pictures to assess pain. Rationale: a pain scale with pictures, such as the Wong-Baker Faces Pain Rating Scale, is useful when language barriers prevent verbal communication. Vital signs, B, can be influenced by many factors and are not specific to pain. Family members, C, and observation, D, are supplementary but less reliable methods. 53. A nurse is caring for a patient who is receiving an epidural analgesia pump for postoperative pain control. The nurse should assess the patient for which of the following potential complications? A. Respiratory depression. B. Hypertension. C. Hypoglycemia. D. Gastrointestinal bleeding. Answer: A. Respiratory depression. Rationale: epidural analgesia, especially when opioids are used, can cause respiratory depression. Hypertension, B, hypoglycemia, C, and gastrointestinal bleeding, D, are not common complications associated with epidural analgesia. 54. A nurse is caring for a patient with acute pain related to an injury. Which of the following is an appropriate non-pharmacological intervention to help manage the patient's pain? A. Applying a warm compress to the injured area. B. Administering a mild sedative. C. Engaging the patient in physical therapy exercises. D. Giving the patient a full meal to improve comfort. Answer: A. Applying a warm compress to the injured area. Rationale: a warm compress, A, can be helpful for pain management in certain injuries, such as muscle or joint pain. Sedatives, B, may cause excessive sedation. Physical therapy, C, may not be appropriate immediately after an injury, and a full meal, D, is not an appropriate intervention for pain relief. 55. A patient recovering from surgery is experiencing severe acute pain despite receiving prescribed analgesics. The nurse should first: A. Increase the dosage of the pain medication. B. Reassess the patient's pain and discuss alternative interventions. C. Encourage the patient to engage in deep breathing exercises. D. Call the physician for a new prescription for pain medication. Answer: B. Reassess the patient's pain and discuss alternative interventions. Rationale: the first step is to reassess the patient's pain level and consider alternative interventions, such as adjunctive therapies. Increasing medication, A, may be necessary but should be done after reassessment. Deep breathing, C, can help but may not fully relieve pain. Calling the physician, D, may be necessary, but reassessment should come first. 56. A nurse is caring for a patient with acute pain following a motor vehicle accident. Which of the following should the nurse monitor closely in this patient receiving opioid analgesics? A. Blood glucose levels. B. Respiratory rate. C. Serum sodium levels. D. Skin turgor. Answer: B. Respiratory rate. Rationale: opioid analgesics can cause respiratory depression, so the nurse must monitor the respiratory rate closely. Blood glucose, A, serum sodium, C, and skin turgor, D, are not primary concerns in this context. 57. A nurse is caring for a patient with a history of opioid addiction who requires pain management for an acute injury. Which of the following actions is the most appropriate? A. Provide the patient with non-opioid medications whenever possible. B. Administer the highest dose of opioid medications to manage pain. C. Restrict the use of any pain medications to avoid addiction. D. Encourage the patient to use herbal remedies to manage pain. Answer. A. To provide the patient with non-opioid medications whenever possible. Rationale. For patients with a history of opioid addiction, the priority is to use non-opioid medications when possible. Administering high doses of opioids, B, can lead to misuse, and avoiding pain medications, C, can lead to inadequate pain management. Herbal remedies, D, may not be effective or safe. 58. A nurse is caring for a patient who is experiencing acute pain after a leg fracture. The patient asks about alternative methods to manage pain. What is the most appropriate response? A. Using herbal remedies is a good way to manage pain. B. Distraction techniques such as listening to music can help reduce pain. C. You should try to bear through the pain as much as possible. D. Pain management is only effective through medication. Answer. B. Distraction techniques such as listening to music can help reduce pain. Rationale. Distraction techniques like listening to music are effective non-pharmacological interventions for pain management. Herbal remedies, A, may not be effective. Bearing through pain, C, is not recommended, and pain management should include both medication and non-pharmacological methods, D. 59. A patient is receiving a patient-controlled analgesia, PCA, pump for pain management after surgery. The nurse should instruct the patient to A. Wait for the pain to become unbearable before using the PCA pump. B. Only use the PCA pump when instructed by the healthcare provider. C. Use the PCA pump as prescribed, even when pain is mild. D. Limit the use of the PCA pump to avoid becoming dependent. Answer. C. Use the PCA pump as prescribed, even when pain is mild. Rationale. The patient should use the PCA pump as prescribed, which allows for self-administration of pain relief when needed. Waiting for severe pain, A, or using the PCA pump infrequently, B, D, can lead to inadequate pain management. 60. A nurse is caring for a patient who is receiving opioid analgesics for severe pain. Which of the following assessments is a priority for this patient? A. Monitoring for signs of constipation. B. Monitoring for respiratory depression. C. Monitoring for nausea and vomiting. D. Monitoring for signs of infection. Answer. B. Monitoring for respiratory depression. Rationale. Respiratory depression is the most serious side effect of opioids and requires immediate attention. Monitoring for constipation, A, nausea, C, and infection, D, are important, but respiratory depression is the priority. 61. A patient recovering from surgery reports feeling pain that is not relieved by their prescribed pain medications. What is the nurse's next best action? A. Reassure the patient that the pain will subside soon. B. Administer a higher dose of pain medication without consulting the healthcare provider. C. Assess the patient's pain level and consult with the healthcare provider for alternative pain management options. D. Encourage the patient to use relaxation techniques only. Answer. C. Assess the patient's pain level and consult with the healthcare provider for alternative pain management options. Rationale. If pain is not adequately relieved, the nurse should assess the pain and consult the healthcare provider to adjust the pain management plan. Reassurance, A, is not enough, and increasing the dose, B, should be done only with a provider's order. Relaxation techniques, D, can help but may not be sufficient alone. 62. A patient with acute pain related to a burn injury is receiving opioids for pain management. What is the most appropriate nursing intervention to help prevent opioid tolerance? A. Use the smallest effective dose of opioid medication. B. Administer opioids on a fixed schedule rather than as needed. C. Avoid using any opioid medications for pain relief. D. Encourage the patient to decrease their pain level naturally without medication. Answer. A. Use the smallest effective dose of opioid medication. Rationale. The smallest effective dose of opioids should be used to manage pain while preventing tolerance and minimizing side effects. Fixed dosing, B, may not be necessary unless prescribed. Avoiding opioids, C, and natural pain relief, D, are inappropriate for managing acute pain effectively. 63. A patient who is recovering from surgery reports feeling an increase in pain after a physical therapy session. What is the nurse's priority action? A. Administer the prescribed pain medication. B. Encourage the patient to continue with the therapy. C. Increase the intensity of the physical therapy. D. Discontinue pain medications to prevent dependency. Answer: A. Administer the prescribed pain medication. Rationale: pain management should be prioritized to provide relief before further therapy is attempted. Administering pain medication, A, will help manage the pain and allow the patient to engage more effectively in therapy later. Continuing therapy, B, increasing intensity, C, or withholding medication, D, could worsen the patient's discomfort. 64. Which of the following is the most effective non-pharmacological intervention for a patient with acute pain from a musculoskeletal injury? A. Transcutaneous electrical nerve stimulation, TENS. B. Encouraging the patient to drink water frequently. C. Administering 4 fluids. D. Applying a cold compress to the affected area. Answer: A. Transcutaneous electrical nerve stimulation, TENS. Rationale: TENS is an effective non-pharmacological method for managing musculoskeletal pain by disrupting pain signals. Drinking water, B, and administering fluids, C, may not address pain directly, while cold compresses, D, can provide some relief but are not as effective as TENS for musculoskeletal injuries. 65. A patient is receiving epidural analgesia for pain management. What is the nurse's priority when caring for this patient? A. Monitor the patient for signs of respiratory depression. B. Monitor for signs of dehydration. C. Encourage the patient to drink fluids regularly. D. Assess the patient's body temperature regularly. Answer: A. Monitor the patient for signs of respiratory depression. Rationale: epidural analgesia, especially with opioids, can lead to respiratory depression. Therefore, the nurse should prioritize monitoring the patient's respiratory rate and oxygen saturation. Dehydration, B, and body temperature, D, are less of a concern, and fluid encouragement, C, should be done as appropriate but is secondary. 66. A nurse is caring for a patient who is receiving opioid analgesics for acute pain. The patient starts to show signs of respiratory depression. What should the nurse do first? A. Notify the healthcare provider. B. Administer naloxone as prescribed. C. Increase the oxygen flow. D. Document the event and continue to monitor. Answer: B. Administer naloxone as prescribed. Rationale: naloxone is an opioid antagonist that reverses respiratory depression. Administering naloxone, B, is the first intervention. Notifying the provider, A, is important, but naloxone should be given immediately to reverse the effects. Oxygen, C, may be necessary, but naloxone is the priority. Documentation, D, should follow after stabilization. 67. A nurse is caring for a patient who is using a patient-controlled analgesia, PCA, pump. The nurse should educate the patient to A. Wait for pain to be severe before using the PCA. B. Use the PCA as needed, but never exceed the prescribed dosage. C. Limit the PCA usage to every 4 hours. D. Use the PCA only when a nurse is present to assist. Answer: B. Use the PCA as needed, but never exceed the prescribed dosage. Rationale: the PCA pump allows the patient to manage their pain by self-administering medication as prescribed. Waiting for severe pain, A, or limiting usage, C, is not appropriate. Using the PCA only when a nurse is present, D, limits the effectiveness of the patient's ability to manage their own pain. 68. A nurse is assessing a patient with acute pain. Which of the following symptoms would suggest that the pain is acute and not chronic? A. Pain that persists for more than 6 months. B. Pain that is constant and dull in nature. C. Pain that is associated with a recent injury or surgery. D. Pain that fluctuates in intensity throughout the day. Answer: C. Pain that is associated with a recent injury or surgery. Rationale: acute pain is typically associated with a recent injury or surgery and occurs for a short duration. Chronic pain, A, B, lasts longer and may be constant or intermittent. Fluctuating pain, D, can occur in both acute and chronic pain but is less specific. 69. A nurse is educating a patient about the use of non-pharmacological pain management strategies. Which of the following techniques should the nurse recommend for managing acute pain? Deep breathing exercises. B. Heavy physical activity. C. Strict bed rest. D. Limiting hydration. Answer: A. Deep breathing exercises. Rationale: deep breathing exercises can help reduce acute pain by promoting relaxation and reducing stress. Heavy physical activity, B, and strict bed rest, C, are not recommended for managing acute pain. Limiting hydration, D, may not be beneficial for pain management. 70. A patient with severe acute pain from a recent surgery is being treated with opioid analgesics. The nurse notices that the patient is becoming increasingly drowsy and difficult to arouse. What is the priority action? A. Notify the healthcare provider immediately. B. Administer naloxone to reverse opioid effects. C. Increase the oxygen flow to improve oxygenation. D. Withhold further opioid doses until the next assessment. Answer: B. Administer naloxone to reverse opioid effects. Rationale: the patient is showing signs of opioid overdose, and naloxone is the first-line treatment to reverse respiratory depression and sedation. Notifying the provider, A, and increasing oxygen, C, are important but should be done after naloxone administration. Withholding opioids, D, may be appropriate later but is not the immediate priority. 71. A patient recovering from surgery is experiencing moderate acute pain. The nurse is planning to use both pharmacological and non-pharmacological interventions. Which of the following non-pharmacological interventions should the nurse implement first? A. Guided imagery. B. Relaxation techniques. C. Ice application to the surgical site. D. Positioning the patient for comfort. Answer: D. Positioning the patient for comfort. Rationale: positioning for comfort is the most immediate non-pharmacological intervention that can provide relief. Ice application, C, can also help but may not be the first step. Guided imagery, A, and relaxation techniques, B, are useful but may not provide the same immediate relief as positioning. 72. A nurse is educating a patient on the use of heat therapy for acute pain relief. Which of the following statements indicates that the patient understands the instructions? A. I can apply heat to my injury for as long as I need. B. Heat therapy should be applied for no more than 20 minutes at a time. C. I should avoid using heat on my injury if it's swollen. D. I can use heat therapy without any concerns about burns. Answer: B. Heat therapy should be applied for no more than 20 minutes at a time. Rationale: heat therapy should be used for short durations, 20 minutes or less, to avoid burns or skin damage. Heat should not be applied to swollen areas, C, and should be used with caution. Statements A and D are inaccurate and indicate a lack of understanding about heat therapy. 73. A nurse is caring for a patient who has chronic pain. Which of the following interventions is most appropriate to prevent the pain from escalating to acute pain? A. Use opioids for pain management. B. Encourage a high level of physical activity. C. Educate the patient about pain management strategies. D. Limit pain medications to avoid dependency. Answer: C. Educate the patient about pain management strategies. Rationale: educating the patient on how to manage chronic pain can help prevent the escalation of pain into acute episodes. Opioids, A, should be used cautiously, and limiting medications, D, can lead to inadequate pain management. Physical activity, B, should be appropriate to the patient's condition. 74. A nurse is administering an opioid analgesic to a patient with acute pain. Which of the following side effects should the nurse monitor for most closely? A. Bradycardia. B. Tachycardia. C. Respiratory depression. D. Diarrhea. Answer: C. Respiratory depression. Rationale: respiratory depression is the most critical side effect of opioids that requires immediate attention. Bradycardia, A, tachycardia, B, and diarrhea, D, are less common and less dangerous in this context. 75. A patient with acute pain is receiving opioid analgesics. What is the most important nursing intervention to minimize the risk of opioid-related complications? A. Ensure the patient receives adequate hydration. B. Encourage the patient to exercise regularly. C. Monitor the patient's respiratory rate and level of consciousness. D. Administer a stool softener as prescribed. Answer. C. Monitor the patient's respiratory rate and level of consciousness. Rationale. The most important nursing intervention for patients on opioids is to monitor respiratory rate and level of consciousness due to the risk of respiratory depression. Hydration, A, and exercise, B, are secondary considerations, and stool softeners, D, are important but not the most urgent. 76. A nurse is caring for a postoperative patient who is experiencing acute pain. Which of the following actions is most appropriate to ensure optimal pain management? A. Administer pain medication on a fixed schedule rather than as needed. B. Encourage the patient to wait until the pain becomes severe before requesting medication. C. Administer the lowest dose of pain medication available to minimize side effects. D. Allow the patient to choose the timing and dosage of pain medication. Answer. A. Administer pain medication on a fixed schedule rather than as needed. Rationale. For optimal pain management, especially after surgery, pain medication should be administered on a fixed schedule to prevent the pain from becoming severe. Waiting until pain is severe, B, may lead to inadequate pain control, and dosage adjustments should be based on healthcare provider orders, C. Allowing the patient to choose, D, may not be appropriate in all settings. 77. A nurse is caring for a patient receiving opioid analgesics for acute pain. Which of the following assessments should the nurse prioritize? A. Assess the patient's level of pain and sedation. B. Monitor the patient's blood pressure every hour. C. Check for signs of dehydration. D. Assess the patient's urinary output. Answer. A. Assess the patient's level of pain and sedation. Rationale. It is essential to assess the level of pain and sedation in patients receiving opioids to ensure they are receiving adequate pain relief without excessive sedation. Monitoring blood pressure, B, dehydration, C, and urinary output, D, are secondary concerns unless specific symptoms arise. 78. A patient is recovering from surgery and reports pain 2 hours after receiving opioid analgesics. What is the nurse's most appropriate action? A. Administer a higher dose of the opioid analgesic. B. Notify the healthcare provider to adjust the medication. C. Administer the prescribed analgesic as ordered and assess pain level. D. Tell the patient to wait for the medication to take effect. Answer. C. Administer the prescribed analgesic as ordered and assess pain level. Rationale. The nurse should administer the prescribed dose as ordered and assess the effectiveness of pain management. If the pain continues or worsens, the healthcare provider may need to adjust the regimen. B. 79. A patient receiving opioid analgesics for acute pain reports feeling nauseous. Which of the following is the most appropriate action for the nurse to take? A. Administer an antiemetic as prescribed. B. Stop the opioid analgesic immediately. C. Decrease the fluid intake. D. Encourage the patient to eat solid food to reduce nausea. Answer. A. Administer an antiemetic as prescribed. Rationale. Nausea is a common side effect of opioids, and administering an antiemetic, A, will help alleviate the symptoms. Stopping the opioid, B, is not appropriate unless the patient's condition warrants it, and decreasing fluids or encouraging solid food, C, D, may not effectively address nausea caused by the opioid. 80. A nurse is caring for a patient who is receiving a PCA, patient-controlled analgesia, pump. Which of the following actions should the nurse take? A. Teach the patient to push the button before the pain starts. B. Teach the patient to wait until the pain is unbearable before using the PCA. C. Ensure the patient understands the risks of overdosing with the PCA. D. Limit the patient's use of the PCA to every 3 hours. Answer. C. Ensure the patient understands the risks of overdosing with the PCA. Rationale. It is important to educate the patient about the risks of overdose and how to safely use the PCA pump. The patient should push the button as needed, A, but waiting until pain is unbearable, B, is not ideal. Limiting PCA usage, D, goes against the purpose of patient-controlled analgesia.